Hi, everybody. I'm Peter Shields, the Deputy Director of the Comprehensive Cancer Center. Good evening, Ambassador and friends. This is our second virtual session since the inception of the Ambassadors Society back in 2012. Thank you for being here. We have more than 100 people on the call. I can't see you. I'm hoping you can see me. Kind of weird doing these town halls that way with everybody being little boxes. But it's great you're here. We're going to have a fun hour. And so we're going to be virtual, for now, and hopefully get a lot of great information to you so that you can be great ambassadors for us. Tonight, we're going to highlight one of our buildings. Ohio State has a number of buildings that are going up. This is one of the two important ones for the cancer program. We're going to talk about the Outpatient Care West Campus Facility, a clinic that's going to be located on Kenny Road across from Morehouse, great location, and actually right next to where we're building our new research building. Nice close proximity, facilitating the research. The building's about 8 stories high, 385,000 square feet. Let me just say housekeeping things. We are going to have a Q&A session. We're going to have a panel first. We're also going to hear from a couple of our key ambassadors. And so if you have questions, you can start plugging them in now or at any time to the Q&A feature at the bottom of your Zoom call. But before we actually welcome and go into the panel discussion, we do have, no surprise, a video. So let's do that. It's from a groundbreaking.
Good afternoon. My name is Bill Farr, and I'm pleased to have you all here today to witness the groundbreaking ceremony for our West Campus Outpatient Clinical Care Facility. This building will be done, hopefully, in 2023, and will provide an array of multidisciplinary clinics, of a state-of-the-art operating room with extended care facilities, with interventional radiology, multiple faculty offices, as well as a CTO, which is our ability to do clinical trials, which will be a big part of our research at the new outpatient facility.
We're a land-grant university. We're also, as you know, a National Cancer Institute designated comprehensive cancer center. So this allows us the kind of unique facilities to carry out that mission and to influence and care for those we serve. What I find most compelling about this new building is it's going to house a proton beam therapy system that really wasn't available when I had cancer 40 years ago.
This is part of a major expansion at the Ohio State Wexner Medical Center. This is one of 3 ambulatory care buildings that we're building here across the region. More and more of the care that we provide can now be provided outside of the hospital setting and can be brought out into the community in an outpatient facility where patients can come in during the day and go home at night.
So I am so excited about this amazing facility where we will really deploy novel, state-of-the-art treatment paradigms for our cancer patients. And what a great opportunity for our interdisciplinary learners to learn the future of cancer care.
This wouldn't be possible without very close collaboration with Nationwide Children's Hospital. We're collaborating on not only protons, but also on the development of flash technology with a Mobitron device that we really developed in collaboration with Nationwide Children's Hospital. Many cancers that are treated just with generic protons have the advantage of the Bragg peak, where the dose is distributed specifically to the tumor but can spare normal tissue. But with the addition of the flash capabilities, even if additional peripheral normal tissues are treated, we can effectively protect those tissues with the flash effect. So this will be truly transformational therapy that only Ohio State will possess for a good long time.
The whole building is being designed with a culture around research, getting patients on clinical trials. If they don't have a clinical trial, getting them the best care. It's going to interact. Right behind us is going up a new research building, so people will be able to walk back and forth and work with the docs and the nurses, the nurse practitioners. It's going to be amazing how this corridor is going to foster research.
The fact that we've got the building with our nursing staff and our physicians, we've got our research team, we've got our radiation facility with both traditional radiation as well as our photon facility, and our nationwide colleagues just make this a building where everything can happen. And it can happen collaboratively, and it can happen in a way that continues to deliver the exemplary care that we already do at the James, but in a state-of-the-art facility.
The fact that all of the relevant therapies and specialists are going to be in one location for the disease that I have, which is chronic leukemia, is very compelling because I can literally participate in one-stop shopping that is very patient-centric, not only for me, but other patients who also have these types of cancers.
Cancer remains the #1 cause of death due to disease in children, and what the Proton Center will do, it will allow us to more effectively treat these patients with fewer long-term side effects.
In the coming decade, thousands of patients will come to this new facility with one wish on their mind: to cure their cancer. Then a team of medical professionals and technology will combine to help grant those wishes. As I stand here today, I see the future. I see cancer being cured and lives being saved.
On the count of 3, we're going to break ground on the new cancer outpatient facility. 1, 2, 3, shovel.
Good afternoon.
Okay, so that's a pretty good introduction. Kind of weird, groundbreaking. You know, supposed to be a lot of crowds and lots of cheering and cutting ribbons and all that other stuff. Instead, it was just us and multiple retakes to make sure we were shoveling the dirt from the best angles. But we were really fortunate to have the president of the university, our new president, Dr. Johnson. We also had Dr. Paz there, as you saw, our chancellor, and the rest of our leadership, as well as Rich Porter from the James Foundation Board. So that was all pretty cool. So let's get to the panel. We have with us today Dr. Bill Farr, who's the CEO of the James, Dr. Arnab Chakravarty, who's the Department Chair of Radiation Oncology, and Dr. Joshua Palmer, who is one of our radiation oncologists focusing on radiation therapy for kids. So we're just waiting for Josh to come on, but we could start. Perfect. Okay, so first question to Dr. Farr. Big building, 8 stories, lots of clinic rooms, great designs for enhancing patient experience, that sort of thing. But we got a lot of buildings. We got a lot of clinics. So why do we need a new facility?
Well, Peter, that's a great question, and it's really amazing. I've been around here for a long time, and have been here for the entire progression of, as you described, James buildings. And when the first hospital opened in 1990, it took us very few years to outgrow that hospital. In a very short period of time, we were taking or being able to occupy rooms in the east part of Doane Hall. And we have continued to grow since that time, from having a breast clinic up at Stone Ridge to really taking over the Morehouse Plaza with all cancer, and building the new breast center, the Stephanie Spielman Breast Center, as well as building our new cancer hospital. Every time it takes us very short period of time to outgrow it. And that's exactly what we've done with the new cancer hospital, which opened in 2014. We completely have outgrown that building. And have taken space over in brain and spine, eye and ear. So we continue to grow. And this building is just a fantastic building. You saw a picture of it. It's 385,000 square feet. This will be our biggest outpatient building, and it is greatly needed. It will have multidisciplinary clinics, infusion services, faculty offices, a CTO office where we run our clinical trials research, support space, as well as much needed 8 new ORs, 2 IR rooms, pre-anesthesia rooms, extended recovery, so patients can stay overnight from surgery. So all of these are very, very needed at this time. It's going to take a while. It's not going to open until sometime in 2023, but it's just going to be able to give us top of the line offices, multidisciplinary clinics where we're all working together in one building, and we'll be able to really further our research and really come up with very innovative treatments. A good example of this is the lymphoma service. About a little over a year ago, they changed the way they treated lymphoma with ibrutinib and other clinical trials and started doing it all as outpatients. So again, innovations like that, where we take what we thought needed to be done inpatient, moving to an outpatient setting, giving us more rooms to have patients in the hospital is very, very significant. And that's what this building is going to provide for us. I haven't mentioned probably the most important part of this building, at least Dr. Chakravarty would agree, is a proton therapy center. Be the first one in Central Ohio. Dr. Chakravarty is going to talk to us about that. But this has been a very great collaboration with Nationwide Children's Hospital. We're going to be able to have really the first proton therapy center in Central Ohio and do a lot of pediatrics as well as adult proton therapy. So this is just a great building. We need it right now. We'll have to wait till 2023, but we're really looking forward to using this to help our patients.
So let's throw this over to Dr. Chakravarty. So cancer care right now has 4 legs, if you will. Surgery, which I was going to say is old-fashioned surgery. Actually, it's not old-fashioned at all. Chemotherapy with targeted therapies, immunotherapies, and radiation therapies. And it seems like every day standard of care is getting better. We're changing how we're doing with our patients, and they're living much longer. So Dr. Chakravarty, you have one of the busiest radiation oncology departments in the country. You're always crushing it in terms of the numbers of patients that go on clinical trials. You got a lot of good radiation therapy. So what's with the proton therapy?
So thank you, Dr. Shields. Thank you for the question. Proton therapy is a type of particle therapy that is fundamentally different from X-ray therapy, which is what we call conventional radiation therapy. And the difference is enormous in terms of physical properties. Without going into too much technical detail, with conventional radiation, you have an entrance and you have an exit dose. And everything in between receives almost full dose radiation. So there's a lot of collateral damage with conventional radiation therapy. And sometimes that manifests itself during treatment, where the patients can get rather sick during treatment. Other times, the late effects of radiation manifest years and decades after the initial course of radiation is administered. And conventional radiation also holds the risk for inducing secondary malignancy. So it's highly effective for many tumors, but there is a risk associated with conventional radiation as well. With proton beam radiation, it has some unique properties in that it just targets the tumor. There's no radiation dose to the surrounding normal tissues. So essentially, it becomes the epitome of personalized therapy, where we can deliver relatively high doses of radiation just to the tumor while sparing all normal tissues. So this will be Central Ohio's first proton therapy center, and it'll be the world's very first flash proton therapy center.
Great, thanks. So let me kick this to Dr. Palmer. So a lot of people don't realize that the cancer researchers in Nationwide Children's Hospital are integral to the Comprehensive Cancer Center. All the faculty down there are actually Ohio State University faculty. They may get paychecks from Nationwide, but they're Department of Surgery, they are the Department of Pediatrics. And so for as long as I know, maybe forever, radiation oncology for the kids, radiation therapy, has actually been given at the OSU campus at the James. And so it's interesting because the facility is designed with the kids in mind to actually be an extension of Nationwide Children. So now we've got Proton coming on board. How is that important for kids, and what would be the kids' experience like coming for that type of therapy?
Well, thank you, Dr. Shields, and that's a really good question. So, there's a number of complexities that occur because of the physical distance between the James Cancer Hospital and Children's Hospital. And so there has been a great deal of work to try to create that sort of patient experience that kind of gives them some sort of continuity so that it feels very similar for them in a number of different things that we've sort of created over the years. The importance of having the Proton Center and sort of also some aspects of photon therapy will be delivered in that area as well in the ambulatory center. But the proton therapy experience for these children is it's going to transition a lot of our patients to the new facility and creating a environment of sort of inclusion and comfort is integral to these patients getting through treatment well. And so the hope is that with this sort of really tight knit and sort of we're all sort of working together with the Children's Hospital physicians to make certain that that effort it comes across and really delivers really excellent care for our pediatric patients. Some of the things that we're actually trying to use to kind of integrate into the new center that we're also piloting at the James is trying to create these new virtual reality sort of experiences for families as well as children so that they can understand what this process is like and help to lower a lot of those anxiety levels in using some of these augmented reality sort of systems
So can I
to
stop you
help
there
with
for a
that.
second?
Yeah,
Are you
please.
saying that you're putting like a headset on kids before they even get there so they can start to get the experience before they actually walk into the building?
Right, exactly. So we have a number of sort of Oculus headsets and virtual reality environments created that will simulate what the experience for that child will be like at the James. And so the hope in that we're piloting is that this experience can begin at Children's. It can then be done again at the James and can be done at home, but then also at the Proton Center. And then we want to sort of create an experience, and part of what we're researching is creating sort of a seamless experience where they will get sort of used to this environment virtually, and then with an augmented reality system, learn more about the treatment, can help with the parents as well, kind of getting used to the environment. And then we also want to be using essentially augmented reality on the treatment machines so that they can watch videos, watch movies, be distracted so that they can actually make it through therapy with as little anxiety as possible.
So I just want to make sure I understand this. Okay. So as part of the virtual reality, you could put the headset on the parents who will see what the kids will see when the parents aren't allowed in the room and be able to talk to those kids as if they actually know what was going on in the room where they're not allowed to be during the therapy.
That's exactly right. That's exactly right.
So I think I heard Dr. Chakravarty say that proton therapy is not necessarily new, but the one we're getting is like the 80th generation on steroids. It's so far ahead of everything else that's out there.
Exactly. It's going to be in a critical space for us to be able to really pioneer new techniques, new therapy delivery, be able to treat patients with sort of the top of the line proton treatment so that they can really have both not only just a good experience with getting through the therapy well, but also demonstrate that there's good outcomes with their cancer and little toxicity. And so I think we're really setting up an amazing facility.
So I hate to bring up money, but these things don't happen, they don't grow on trees. So Dr. Farr, philanthropy here, our ambassadors, where they're out there hitting the streets, helping to bring in dollars for us. How has the philanthropic support impacted this outpatient care facility, and what are the needs going forward?
Well, Peter, you bring up a really significant problem because our buildings that are going up around campus are just phenomenal. As everyone knows, we're building a new university hospital. We're building the research center, a new medical school, a new dental school. It just goes on and on, the buildings that's going on right now. And yes, operations can help out, but a big part of completing these buildings is through philanthropy. Our development team across the James as well as across the campus have extremely high and lofty goals to help us complete all of these buildings. There's still some concern that we may not have enough money to finish all the space in the outpatient facility, and we may have to shell some space until we can get enough money from operations or raise enough money. So all you ambassadors out there, a big part of your job is to get out and tell people what we're all about at the James, and to see if they want to help us out with some donations. But that's going to be a big part of the success of completing all of the building projects that we have going on. We don't have all the money for the outpatient ambulatory center yet, but with all of your help, we'll get there.
So let's give another really good example of a need. So Dr. Chakravarty, you mentioned the word flash. Okay, now, if I understand this correctly, it's only been used in an older generation proton facility around the world, and just actually a couple of patients. This is something that's highly experimental, and it's going to take real dollars to develop this so it's ready to be treated in patients. So what is flash going to do for us? Let's say it's 5 years from now, we're doing clinical trials, 10 years, it's popping up around the world. What is this? And try to make it not too physics oriented. I can't spell the word physics, so try to get it into lay language.
Thank you, Peter. I'll give you a quiz afterwards. So flash is defined as ultra high dose rate radiation in excess of 40 gray per second. In comparison, conventional radiation only achieves a fraction of this at 0.1 gray per second or less. So you can do the math. Flash is about 400 times more potent than conventional radiation. Conventional radiation often requires 6 to 8 weeks of treatment, 5 days a week, often constituting over 30 to 40 separate treatments. So patients have to go back and forth from home to the radiation center over a span of anywhere from 6 to 8 weeks normally. So it's a big toll on cancer patients who are otherwise rather sick on occasion, and often are in situations where transportation is difficult. So flash, you can deliver the same total dose in less than 1/10 of a second, in contrast, if you can believe that. So
it's like a blink of an eye.
Exactly. It's quicker than you can blink an eye. So the contrast between flash and conventional radiation couldn't be more stark. So I was one of the first to conceive of flash when I was at Harvard back in 2009, before 2009. And we found some initial data that was very interesting. And there were other groups over the past several years who had proton equipment who carried on the work and confirmed my initial findings that flash could in some cases be more effective than conventional radiation with almost no toxicities to normal tissues whatsoever. So our unit will consist of 2 gantries and 1 fixed beam. So in lay terms, there are going to be 3 different treatment rooms. And all of the treatment rooms, all 3 rooms will be flash capable. So this is a very, very novel, exciting technology. Ohio State will have the very first out-of-the-box flash therapy solution in the world.
It's going to take a lot of research, which costs dollars, so that we can prove that this makes a difference for people. All the expectations are there. So I want to emphasize again the importance of the partnership with Nationwide Children's Hospital, because they're putting substantial amounts of dollars with OSU, and without them, this proton facility would not be here. So Dr. Palmer, you were talking a lot about a lot of the research, but could you give us an example of some of the clinical trials that could happen at this facility for kids?
Of course. So there's a couple of really unique things that would sort of drive how special this relationship is between Nationwide Children's and us, and sort of sets us apart from a lot of the other centers in our region and nationally. One is that there's clinical trials where we're using a more sophisticated radiation treatment called stereotactic body radiation therapy, which is a high dose of a very focal treatment for children with sarcomas. And so we're really one of 3 institutions in the world where we're using that type of radiosurgery for pediatric patients. And so we're sort of pioneering with our nationwide colleagues some of these new techniques that we will use both here and at the new ambulatory center. Like we mentioned, we touched briefly on the augmented reality. There's really only a few institutions around the world that do this right now with virtual and augmented reality for patients. One is with a partner that I have at Stanford, and then another at the University of Colorado, that we are sort of working on collaborative clinical trials to actually bring this into a larger scope, so we can actually show that this is meaningful and bring it into a national setting where people around the world could use these technologies. And so that's another unique partnership that we have both with the Nationwide Children's Hospital, but allows us to sort of bring these unique technologies and use it for our patients. And I think because of our unique patient population, the relationship that we have with Nationwide Children's allows us to use these collaborations and bring it to our patients.
Great, thank you. So let me move on to Sue and Courtney. We're going to have questions and answers. Put your questions into the Q&A box. I see there's 2 good ones there already. Let me now, I just lost my place in my agenda here. Sorry. So Sue and Courtney, where am I? We have a video. That's where it is. I'm off. Okay. So thanks to the panel. We're coming back to you guys. Sue and Courtney, welcome. You have been big supporters of us. Buckeye Cruise for Cancer. I went on my first one last year. Obviously, we didn't go this year, but it's a really important event. You guys have been through this, and so you're going to make it real for us. It's not just a bunch of physics and machines. So are we? So let's go through the patient story first, and then we'll come back to you guys.
Thank you so much for having us. Yes, thank you. I think they're going to be showing some different pictures that we have, but we are so excited. We have been waiting for years for the proton radiation to come to Central Ohio. Courtney was just 15 when she was diagnosed with the central neurocytoma brain tumor. And she had surgery shortly thereafter, 6 days after, at Nationwide Children's Hospital by Dr. Kosnick. He was only able to remove 25% of it due to how vascular it was in nature. So we had to consult with the James Radiology about what the treatment, the best next option would be. And at the time, the radiologist there said it would be such a large section of her brain that would receive the radiation that they really recommended that we get try to get more of the tumor removed. She was a straight A student. They were concerned about the long-term implications of having that much of her brain radiated. And we went to Boston Children's Hospital for a second surgery, and that didn't go well at all. She almost bled out on the operating table. We tried chemotherapy back at Nationwide Children's Hospital. That didn't work. So our next option really was proton radiation. At the time, there were only 6 centers in the country. Indianapolis had just come on. This was back in 2007, but they had a very long waiting list to get in. Luckily, Dr. Kosnick had a relationship with Dr. Nancy Tarbell at Mass General in Boston, and we went there for an evaluation and actually had to live in Boston for 7 weeks. So again, implications to the family and the overall experience is we have 2 other children. She was, 15 in starting her sophomore year at Gahanna Lincoln High School here in Columbus. And, we had to be in Boston for 7 weeks and had the proton radiation. It ended up being very successful. We came back and we had the radiation. She had radiation in the fall of 2007. By December, it had shrunk substantially, which was much faster than what they had anticipated. And within the next year and a half, it really had just been reduced to scar tissue. We were very fortunate that we had very good insurance and the wherewithal to be a block and a half away from Mass General so that we could just walk over in the morning for treatment. It would take a half an hour and we would be done for the rest of the day. She would be, trying to stay on top of her schoolwork, all of that, and try to stay connected with family and friends, back here in Columbus. So it was hard overall. We met people from all over the world, though, that came to Boston and Mass General to have the treatment. As a parent, I couldn't go in and see anything that was going on. So with the whole virtual reality, that would have been, great. There were a few teenagers there. Most of the pediatrics were young, so they all had to be sedated for the treatment. So it was an overall, it was a good experience for us, but it just makes you realize how fortunate you would be to have something of this caliber right here in Central Ohio and make it so easy to get the treatment. She graduated valedictorian from Gahanna in 2010 and graduated from the Ohio State University in 2014. And ever since then, we've made it our mission to really be an ambassador for the treatment that she received. And we know that with the proton radiation, she has not had, a lot of the side effects that we were really worried about with, regular radiation. So I will let you kind of jump in and say anything.
Yeah, so I just wanted to go over the pictures that we're scrolling through since there wasn't any explanation. I'm sorry. That first picture was of my very first MRI in December of 2006. The next one was, yep, that doozy there. That was my scar after my first surgery. That was my MRI after chemo. So it had shrunk, but not to the point where they were wanting it.
It's right in the middle there for folks.
Yeah, right. So that's why they were so worried about doing the conventional radiation, because it would have been my entire brain that they would have had to done. And I was 15 years old. So I can't even imagine what my life would be like now if we had gone that path. That's our apartment in Boston. I celebrated my 16th birthday during treatment. So I got a lot of cards and decorated our little apartment. And my treatment would be so early in the morning, we'd be done. I'd take a nap, we'd go out exploring Boston, I'd come back and do some schoolwork. So we made the best of it. And that's just one of the pictures that we took just so we could always remember what it was like. And I know it was 13 years ago now, but the technology and how far it's come is just incredible. And I'm so excited with all the advancements.
And the building was huge. The space of where she would get put off into like this tunnel, and the radiation, the wheel would go around. I mean, it was stories high, it was massive, which I understand from the new building with the new technology is going to be very, very different from that. But we were down kind of in the basement. Oh, this is the picture.
From the cruise this year, for the survivor breakfast, our survivor at my table was Terrence Dials. A little tall, a little tall.
That's really, really, really
it's
great
incredible.
stuff.
And I know I owe not only my life, but my quality of life to proton radiation. So I'm just thrilled that we're getting one right here in Columbus, Ohio.
Yeah, I mean, whole brain radiation to someone at the age of 15 when their brain is developing is not a trivial thing, that's for sure. So this is really amazing stuff. And thank you for sharing this. I always marvel at folks who go through this. I mean, you probably look at these pictures and think it's, you know, so foreign. And I always joke around, at least for you, it's now past medical history. But it's really great for you to be able to share that. And I finally figured out why I thought you have a video. So I've got a great roadmap in front of me for these sessions, and it says Sue and Courtney video to start, meaning your video turns on, not video. So here we are in a Zoom world where we have to redefine how we even give directions to folks like me. So we have time for questions. We have 2 of them, and so we'll keep this conversation going. So the first one is for Arnab Chakravarti. Could you discuss how flash radiation would open up so many more patients to experience the James quality radiation therapy? The treatment time is so short. There's, you know, a lot of impact on travel. You don't have to do the multiple days and things like that. So what type of feedback? What can you say in addition to the obvious stuff, but from your position as the treating physician, the impact on the patient's life?
So that's really an excellent question and observation. You're right, conventional radiation, conventional proton radiation as well, often involves 6 to 8 weeks of treatment, back and forth, countless hours. You're right, with flash therapy, it's conceivable that the entire treatment will be delivered in less than 1/10 of a second, and the patient experience could just be a few hours at the James Cancer Hospital, and they're done with at least the radiation component of their therapy. I think the assessment that this will open up patient slots to other cancer patients in the community is a very good one, because we have patients from all around Ohio and all around the upper Midwest who would ideally like to be treated at the James, but simply cannot trek back and forth, let's say from Michigan, over a span of 8 weeks. And they may not have the financial resources to be housed in Columbus for that span of time. So especially for the economically disadvantaged, I think it really opens up opportunities, which I think we should champion. It also opens up opportunities for international clientele. And as you know, Peter, there are governments really throughout the world who have approached us to establish partnerships. We have actually more than that, over 30 agreements signed with international institutions for research and for academic advancement. And some of those institutions want to start sending patients our way. The government of Saudi Arabia, of course, has been sending us pediatric patients for the past year. So this really expands the global reach of the James, and it also, maybe more importantly, extends the local reach of the James to those communities that might be economically disadvantaged. So thank you for that question.
That's great. So I'll actually take the next question myself. Are Pelotonia funds being steered towards the Flash Proton Center? So I'm going to answer it in a funny way and then explain it. because Pelotania funds are not being steered towards the Flash Proton Center, because our commitment is 100% of the Pelotania dollars is for research. So it's not going for the bricks and mortar, okay? But Pelotania dollars will definitely be supporting the research, will be supporting the development of Flash, will be supporting the physician scientists who will be using that equipment. And so Pelotania will be integral to making this not just a, I shouldn't say it this way, a community, based hospital effort in proton. So we're going to be doing a lot of work, the clinical trials, that sort of thing. But the Pelotania funds itself doesn't go to pay for the building, which is one reason why we need to find other sources of funding. So the next question, I guess, is going to go back to Dr. Chakravarty. Will flash therapy be used for all types of cancer?
Another excellent question. And the answer to that, Dr. Shields, goes back to your observation that Pelotania funds will be used for flash research. So that question will be answered based upon initially preclinical investigation, followed by clinical trials. Believe it or not, we have partnered with a veterinary hospital here to run some of the initial clinical trials on dogs and cats and horses, believe it or not, yes, horses with cancer. So dogs, for example, develop glioblastoma and oftentimes very aggressive glioblastomas. So we have submitted a protocol to be approved through our animal IRB, which proposes utilization of flash therapy for these malignant brain tumors in dogs. Likewise, dogs and cats often get head and neck cancers, much like human subjects. So for the sake of argument, if these initial investigations are promising, that would lead to clinical trial development in those tumor types. So we're going to investigate each and every type of tumor preclinically, then in veterinary subjects, then in human subjects, to answer that question scientifically. So I'm hopeful that our initial clinical trials will be based upon solid scientific data, thanks to the Pelotania funds and thanks to the generous donors in our community to support this work. But we could make some real impact in the treatment of some for some cancers that are presently, frankly, untreatable.
Yeah. So Dr. Farr, I'll probably have two questions for you, but I'll break this down. How are we doing on patient volume, inpatient census, and really in the context of the feeling out in the community that we're all should be staying home, but particularly hospitals and clinics have lots of COVID there going on, and is it safe? So the question is really, is it safe for people to come in and get their medical care of any type?
Well, Peter, that's a very good question. And, there's no really complete answer on that as we learn more and more about COVID. But as you recall, back in March, when COVID really became a significant problem for all of us, we did close down a lot of our operations in the hospital. From patients would not come in for screening exams, for instance, a mammogram. Patients that have either a very low-grade tumor or even a benign process would not be operated on. And we slowly evolved to make it safe both for the patients as well as the nursing staff, as well as the doctors, to the point where now, for instance, in regards to surgery, all patients get tested for COVID a couple days before surgery, and so everything is essentially back to normal. Our admissions are just now getting back to normal, but our outpatient numbers and our OR numbers, as I said, are really above the pre-COVID areas. I think we've gotten to know so much about COVID than we did know 5 or 6 months ago. So it is safe. I can truly say that. There's only 0.2 cases have been shown to come from a patient to one of our workers. So it's really very safe. We need to get back. Needs to get back to do their screening exams, needs to get back for their treatment, be it chemotherapy or surgery. There is data out there that because of all of these delays, that we may be seeing an increase in mortality from cancer, which has been going down for the last 20 years. We may see an increase over the next couple years because of COVID effect.
Yeah, and the context of that, if you're a patient coming in, you're not interacting with other patients who might be sick with COVID. You're interacting with the staff. And we have lots of protocols in there to prevent the staff from even getting infected, including everything from daily temperature reporting. You'll notice we're all wearing some sort of eyewear as well as masks. So we're making it a safe workplace environment. And if it's a safe workplace environment, it's going to be safe for the patients too. But I want you to emphasize, Dr. Farr, that really that last point, so COVID-19 or worry about COVID-19 doesn't stop your cancer from growing. And if you have an early stage lesion and you wait to get later, that's a problem. I mean, we're getting better at curing advanced stage cancers, but not enough. Our best shot is early. So can you emphasize more about where we are with this early screening?
Well, yes, Peter, and I think we are back. At least from the physicians I've talked to, we are back to our normal screening levels. So patients are coming back. And as I said, our OR volume is up. Talking to other cancer centers around the country, all of their OR schedules are booked tight. And so I think people are feeling more comfortable. But we're not there yet. There's still a lot of people that haven't come back to get their surgeries, to be seen in clinic on a regular basis. But we're getting there, and I think people are becoming more willing to go out. But as we sit here talking about this, we also hear that there's another surge, that all the states are increasing in volumes of cases, which continues to be a worry for many people. But I think the bottom line is the more we learn about COVID-19, the better recommendations we can make to our patients.
Yeah, and to emphasize those 2 points is we are smarter. We've gotten to test our systems. So back in the spring, there was feeling of chaos, although there wasn't chaos. Now we've tested a lot of ways of keeping both the patients and the staff safe. I mean, I think what it is it's hard to cross that threshold. I feel like I'm selling like restaurant or theater tickets. Like, you got to come on down and see us. And once you're in the building, you'll see all the protocols that are in place to make everybody feel pretty safe. The next question, I love this question. So as an ambassador, I like to introduce my friends to this information. Will there be more of these sessions to invite people to join me? So that means that we're doing our job, we're getting information out, people are voting with their feet and wanting more of these sessions. The answer is definitely there will be more. And in one way of this weird world we're in, Zoom makes this much more accessible. So you don't have to drive someplace. And I think that these types of listening and learning sessions will be a permanent fixture for all of us, but absolutely there will be more of these sessions. We still have a couple more minutes, so I've got another question here. Staying with Dr. Farr, this is a big building, 8 stories. Are we going to need to recruit more faculty to fill it? Like, how did you figure out how big you needed this building? And does that include plans around recruitment of faculty, growth in patient volumes? How do you go about doing this?
Well, Peter, that's a great question. And, I think the bottom line is yes, we're going to have significant growth, as I mentioned earlier in the program. Anytime we have built anything or extended our treatment to other places, our growth has been tremendous. And go along with that growth, you need to hire people. You know that in the research world, if you're going to increase your research capabilities, you need bodies to do that. And we're the same way across the clinical program. Right now, we are full, and we, as you know, we've been recruiting very hard over the last couple years. But we don't have people sitting around not working. And I think the more space we have, we're going to have 8 more ORs and 3 floors of more clinical activity, multidisciplinary clinics. We're going to need staff to faculty to fill these positions. And so you're going to have to go back to work and hire some more people for us.
Well, and it's not like we're just closing old and decrepit buildings and opening up a new one, right? We're expanding here because of patient volumes and need.
That's exactly right. Nothing's closing, and we'll be more efficient. We'll be able to get patients in on a more timely fashion. We'll be able to as I said, we grow. We had 14 ORs when we opened up the James. We now have 20. Where'd they come from? From sharing at different of the hospitals, University Hospital, Ross. And we get 8 more ORs over there. What that's going to do is provide more space for our surgeons that we brought in. We brought in close to 8-10 surgeons just in the last 3 or 4 months. And we need room for those people. So it's a crunch, and we need to have people available. Patients are coming here, and the more visibility we have, the more excellence in research we have, people are going to want to come here, and it's going to be crucial for us to be able to provide them the care.
And with the new hospital that's replacing the main hospital, we're getting more James beds too, right? The knuckle?
Yes, we'll have another 142 beds, which will give us 508 beds. We'll be the second largest cancer hospital in the country. And we'll also have the ability, as we did in the old James, that if we get crunched for space, we'll be able to move over into the new tower if they have beds available.
I mean, it's really amazing because we're doing so much better at keeping patients out of the hospital with all of our therapies. So the volume of patients going through is incredible. I got to ask Dr. Palmer a question because his lights went out because he wasn't moving enough. And so he had a wave to his motion detector. So you're on the front lines treating patients here. So let me ask you that same question about patient safety and how they feel, and when you're in the room with them, what's the vibes you're getting from these folks? Are they feeling safe? What are their concerns that they're expressing to you?
Yeah, I mean, from the COVID era, I think initially during the first beginning of the pandemic, there was a lot of anxiety. There was a lot of patients that just didn't know what to do. There's a lot of phone calls, a lot of discussions with patients and families, in particular with pediatric families traveling to come and see us. Is this safe? What should we do? Can we put things off? How can we do this safely? And I think what we found is that the James has done an amazing job sort of keeping people safe. And we've really not had any, and I'm one of our very busy sort of with both adults and pediatric patients. And really, I have not seen anybody have a major issue, coming in, getting seen, having getting through the process, there's always little kinks of, things have changed and the processes change. Getting in the door and getting screened and going through all of these things can cause some anxiety, but we've been able to keep people so safe and socially distance appropriately that, a lot of these families are just so thankful that things are so well done, and they get a lot of patient advocates involved downstairs and early on to continue to get people through quickly and efficiently, so that there's really very little that has caused a lot of hiccups in sort of our really busy radiation service.
I
And
think
so
one
I
of
think,
our
yeah,
major issues that we all really, really, really hate is the necessary visitor policy. I
Yeah.
mean, we just can't have that many people walking through a building of, where there's 400 plus cancer patients. By definition, every one of them immunosuppressed. So we just have to keep that foot traffic down as much as possible. And it's really sad for all of us, for people to not have those visitors. So let me just
Peter, before you end, I hate to interrupt, but I think it's important that we really, really give credit and thank our staff, our nurses, everyone. We're sitting here talking about how safe we've made it and everything. And I'll tell you, we have a tremendous staff. We have tremendous docs. Our patient satisfaction dropped from 98% to 97%. So I think that's just remarkable, especially with what Peter was just saying about our visitor policy. But I just wanted to put that in. Sorry to interrupt.
So one of the nice things about Zoom is we're supposed to end now, and we will end in a minute, but I got one more question, but anyone can just drop off and not be rude if they have to go somewhere. But the last question will be, I don't know, Bill, I hope you know or someone knows, but is the medical center doing any planning for 5G technology and networking to advance patient care and operations?
Peter, I have trouble with using my cell phone, so I can't answer that.
You don't know. 5G technology, wireless, the new phone sort of stuff, which is going to enhance a lot of technology. The question's about what the Med Center is doing in this area, if you know. I guess he doesn't know. Okay.
Well, I think from the medical center, as long as we get a good signal in the hospital, that is part of our planning for the patient experience and augmented learning. So it does it sort of expands our capability to create an experience that's more all-encompassing for especially our pediatric patients, where they can actually now use some of this technology as they walk through the department or ride through, because we also kind of have these little cars for them to drive, and so they can sort of keep a comfort level. We can stream, and we've been thinking about this, streaming the parent into a screen that they can view in live is something that's very difficult to do with our current technology. But with 5G capabilities, we could actually create a lot of systems that we just don't have the capability of doing now.
That's really cool. And the fact that some of us don't know the answer to the question doesn't mean that there aren't more areas in the Med Center that are going to use it. Just means that we're not in the room and these things are discussed. So let me close out here, though. I want to thank Sue and Courtney again, and Dr. Chakravarthy and Palmer. I had fun. I hope folks out there had fun. Thanks to all of you ambassadors tuning in tonight. We love your enthusiasm. We want to give you the information. You are critical. We can't get a better validation of our work when we have such great community support like this. So thanks again, and stay well, everyone. Take care. Be healthy.
Thank you.